you on how to achieve a good 3D image. The first and most crucial step to obtaining excellent 3D and 4D images begins with optimizing the 2D image. Before acquiring the volume for 3D imaging, it is essential to ensure that the 2D image has the best possible quality. The 2D base image serves as the foundation for accurate 3D reconstruction, so optimizing this image is vital. This step includes making adjustments to several parameters that directly affect image clarity and resolution. The gain setting controls the overall brightness of the image. A properly adjusted gain ensures that the anatomical structures are clearly visible, neither overexposed nor underexposed. An ideal gain setting enhances both the soft tissues and other structures of interest, making it easier to obtain precise 3D data. The TGC setting compensates for depth-dependent signal loss, ensuring that echoes from different depths are balanced. By adjusting the TGC, the user can avoid overly bright or dark areas in the image, enhancing uniformity and detail throughout the scan. It allows for consistent visualization of structures, particularly in areas where shadows or enhancement might otherwise obscure important features. Focus is critical for obtaining a sharp image. Setting the appropriate focus position ensures that the ultrasound beam is concentrated on the target anatomy. This improves resolution, especially in regions that are further from the probe, leading to better 2D images. Focusing correctly is also a key step before transitioning to 3D imaging, as the sharpness of the 2D image influences the quality of the 3D reconstruction. The image size should be adjusted to include the entire area of interest, ensuring that the anatomical structures are well within view. Setting the appropriate depth ensures that the ultrasound beam captures the entire volume of interest without unnecessary surrounding tissue that might distort the 3D reconstruction. A high-quality 2D image is essential for achieving accurate 3D and 4D reconstructions. Without a clear and well-optimized 2D image, the resulting 3D image will lack clarity and resolution. Even with the most advanced 3D technology, an excellent 2D base is necessary to produce usable 3D data. This highlights the importance of traditional ultrasound skills, as well as the need for advanced knowledge of the technical settings that affect 2D imaging. Once the 2D image is optimized, the next step is to become familiar with the new controls specific to 3D and 4D ultrasound imaging. While the 2D image optimization remains critical, sonographers must also master a range of new parameters such as volume acquisition settings, region of interest adjustments, and controls for volume rendering. Proper use of these controls ensures that the 3D image is well constructed and reflects the target anatomy accurately. For example, understanding how to adjust the sweep speed, volume box size, and slice thickness is crucial for controlling the quality and resolution of the 3D data. These new techniques build upon traditional ultrasound skills, but they also require new knowledge and practice to use effectively. In conclusion, the process of achieving a high-quality 3D image starts with optimizing the 2D image by adjusting key parameters such as gain, TGC, focus, and image size. Once the 2D image is optimized, mastering the 3D controls is essential for acquiring accurate volume data and producing detailed, realistic 3D images. By combining traditional 2D optimization skills with new 3D-specific controls, sonographers can produce the best possible 3D and 4D images, providing enhanced diagnostic capabilities and a clearer understanding of the anatomical structures being examined. Once the 2D image is optimized, the next critical step is the orientation of the 2D image. The sonographer must carefully select an optimal position, ensuring that the anatomy or structure of interest is well aligned and visible. Having a clear idea of the desired outcome for the 3D image is crucial at this stage. Proper orientation minimizes the need for corrections later and helps ensure a high-quality 3D reconstruction. After optimizing and orienting the 2D image, the next step is to activate the 3D or 4D mode. This involves acquiring volume datasets using specialized transducers designed specifically for volume scanning. The process begins with a standard 2D scan, where a volume box is superimposed over the region of interest. The 2D image presented on the screen acts as the central plane of the volume, forming the basis for the eventual 3D reconstruction. Properly setting up this step ensures accurate and comprehensive volume data acquisition. Adjust the region of interest. Once the 2D image is properly oriented and volume scanning is activated, the next crucial step is to adjust the ROI. The volume box serves as the boundary that frames the area to be imaged in 3D. Adjusting this box ensures that the target anatomical structure is fully captured in the scan. To fine-tune the ROI, the green line, representing the boundary of the volume box, needs to be carefully positioned. The green line can be adjusted in terms of position, shape, and rendering direction, allowing the sonographer to optimize the 3D reconstruction. This is critical for ensuring that only the relevant structures are captured and that the volume sweep accurately represents the region of interest. On the 2D screen, you will typically see two dimensions of the volume box, which helps in adjusting its size and positioning relative to the anatomy. The third dimension, depth or volume sweep, can be visualized as a small icon on the screen. This icon represents the volume angle, which indicates the scanning amplitude. By adjusting this, the sonographer can modify the extent of the scan, ensuring that the volume data includes all necessary structures. When imaging specific structures such as the fetal surface, it is important to ensure there is fluid in front of the target organ. The fluid helps in creating a better contrast for the 3D imaging process, enabling clearer visualization of the structure's external surface. On the other hand, when imaging more solid structures such as the fetal bony spine, fluid is of lesser importance. In this case, the bone's echogenicity provides adequate contrast for 3D reconstruction without requiring a fluid medium. Once all adjustments are made to the ROI and the 3D/4D mode is activated, the next step is to begin capturing the volume. Capturing the volume is done by pressing the Start key, which initiates the scan. The sweep time, the amount of time needed to capture the full volume, is dependent on two key factors: the size of the volume box and the scan quality settings that have been chosen. A larger volume box will require a longer sweep time, as more tissue data needs to be acquired. Similarly, higher scan quality settings, which result in finer details, will also increase the sweep time. During the capturing process, the ultrasound transducer performs a sweeping motion, capturing multiple 2D slices of the target anatomy. These slices are then compiled into a 3D volume. Ensuring that the sweep time is balanced between image quality and scan time is critical for obtaining an optimal 3D dataset. After the volume scan is captured, the next step is multi-planar navigation, which allows for detailed inspection and manipulation of the data. The volume data are displayed in a multi-planar view on the ultrasound monitor. This view presents the three key imaging planes: transverse, sagittal, and coronal. These planes are perpendicular to each other, providing a comprehensive view of the anatomy from different perspectives. In addition to these planes, the 3D reconstruction is displayed on the screen, showing a full 3D representation of the region of interest. This enables the operator to assess the structure in 3 dimensions and make further adjustments as needed. One of the key advantages of multiplanar navigation is the flexibility it provides. The operator can select any point on the reference image, allowing them to rotate the volume and adjust the orientation of the scan planes. This capability enables the operator to optimize the rendered image and better visualize structures from different angles. Whether adjusting for optimal visualization of a fetal organ or assessing complex anatomical features, multiplanar navigation is a crucial tool in 3D and 4D imaging. After the volume data is captured and displayed in the multiplanar view, the 3D image can be further manipulated using rotation and translation techniques. Rotation allows the sonographer to rotate the 3D image around all 3 axes X, Y, and Z. In addition to rotation, translation allows for the displacement of the center of rotation of the 3D reconstructed image. This means that the operator can shift the focal point of the 3D model, and the orthogonal planes, transverse, sagittal, and coronal, will be simultaneously updated to reflect this change. Translation is useful for refining the position of the scan volume and enhancing the visualization of specific anatomical areas. An important aspect to consider during rotation and translation is the threshold value. This value determines which signals are included in the 3D reconstruction based on their echogenicity. Optimizing the threshold helps to eliminate noise and artifacts, ensuring the highest possible image quality. Sometimes overlying structures, such as the umbilical cord, placenta, or fetal limbs, can obscure the region of interest in the 3D image. This can make it difficult to accurately assess the target anatomy. The electronic scalpel software option provides a solution for this issue. With the electronic scalpel, the operator can remove overlying structures that interfere with the view of the ROI. This is particularly useful when certain structures, such as the placenta or other fetal parts, block access to the target organ. By removing these obstructions, the operator can focus solely on the region of interest, improving the clarity and diagnostic value of the 3D image. Once the volume has been captured and the image is optimized, the operator can select from a variety of rendering algorithms to visualize the region of interest in the most effective way. These algorithms are crucial for enhancing different anatomical structures and improving image clarity. The operator has the flexibility to choose between different rendering modalities, including surface, transparent, and light modes. Each of these rendering options highlights specific features of the scan volume, making it easier to assess the anatomical structures of interest. Again, surface rendering is a mode that emphasizes the outer surface of the ROI, making it ideal for visualizing the contours and shapes of external anatomical features. Transparent rendering allows the internal structures to be visualized while maintaining transparency in the surrounding tissues, making it useful for assessing internal anatomy and spatial relationships. Light rendering modality simulates the effect of light and shadow, enhancing depth perception and highlighting surface and internal details based on the lighting angle. By choosing the appropriate rendering modality, the sonographer can ensure that the 3D image effectively demonstrates the features of interest, whether focusing on surface anomalies, internal structures, or overall anatomy.